You got to know what your niche is, right? As a business owner, especially in the aesthetic industry, so many people or so many spas are popping up on the corners now. Like a McDonald's is on every corner. It's almost a med spa on every corner. And so they get discouraged because they feel like the industry is saturated. Now, granted, it can be saturated if all you're going to do is pop up and do Botox and fillers. So you have to identify what your niche is. So my niche is that we are a one-stop shop for all things health, wellness, and beauty. Why? I'm a family nurse practitioner, so I can take care of you on your primary care side. 2, I'm psych mental health, so I can also take care of you on your mental health side. And then 3, I'm now well-versed in beauty and aesthetics and wellness, so now you can get all your beauty needs there too, so you can get everything under one roof. So that's how I integrate it into my current practice. It's pretty much a one-stop shop for all things health, wellness, and beauty.
Hello, listeners. Welcome to the You Belong in Here podcast. This is a podcast where we explore the intersection of nursing and racism, racial disparities that African Americans face in healthcare, as well as the inequities that African American nurses, doctors, and nurse practitioners face in the workplace. My name is Dr. Tiffany C. Brown, and I am your host. I am a doctoral level nurse practitioner with more than 23 years of practice in the nursing profession. It is my hope that through hearing the personal stories of triumph and resiliency shared through in-depth interviews from nurses, nurse practitioners, doctors, and DEI experts, you will be empowered in your workplace and know that you belong in here. Now, let's get to our show. Hello, everyone. Welcome again to another episode of You Belong in Here. Of course, I am your host, Dr. Tiffany C. Brown. I am so excited about today's episode, but first, I want to ask you a question. What does success mean to you, and how can redefining it through whole person care transform your overall well-being? Well, my guest today has an answer for you as we explore the topic for today's episode called Success Redefined, Whole Person Care with a Nurse Practitioner and Spa Owner. So let me tell you a bit about my guest. Her name is Dr. Keke Williams, and she's a powerhouse in modern healthcare, a doctoral prepared, dual board certified family and psychiatric mental health nurse practitioner, award-winning entrepreneur, and the visionary behind Sky Rose Rejuvenation Clinic and Spa and Sky Rose RCS Medical Aesthetics Academy. With over a decade of experience, she fuses mental health, aesthetics, and wellness to deliver transformative care that heals from the inside out. As a nationally recognized speaker, trainer, and mentor, Dr. Williams has empowered thousands through her signature Injector Confidence Gap Med Spa CEO Academy programs and has professionally helped launch over a dozen thriving med spas across the country. So she bad, y'all. She's fiercely committed to creating space for Black and Brown providers that look like us to build their wealth, their confidence, and community in the industry that hasn't always reflected them. Now, more than a medical leader, Dr. Williams is a proud single mom of 3, balancing motherhood and mogul moves with grace, grit, and God at the center. Her culturally grounded, heart-led approach is shifting the beauty of wellness in the industry, elevating faces, futures, and a movement rooted in power and legacy. And purpose, of course, too. So welcome, Dr. Keke. I'm so glad to have you on my show today. Welcome.
Honor.
Of course. So people who know me, I kind of like to start my podcast when I interview guests with a little genesis. Tell me your nursing journey, your journey into nursing, and what inspired you to become a nurse practitioner.
My journey was not the typical. And when I say typical, most people, they know exactly or kind of know what they want to do right out of high school. They'll go to like a 4-year college, get their degree, start their career, or get the 4-year nursing degree. Well, I started as a medical assistant. And so when I got a taste of that, it was like a 7-month program. The reason I went to that program, because I am a teen mom. I was pregnant at 17 and I had to figure out something that was going to bring in a steady income other than the fast food restaurants or working at UPS back then. So I'm like, I got to do something different. I have a whole human being that's going to be dependent on me. So my cousin told me about a medical assistant program. I went there, got my MA, my phlebotomy, and my EKG technician all in one. And that's kind of what introduced me to the healthcare field. And so working at a doctor's office, I was able to kind of get the firsthand experience. And so I'm like, maybe I should go a little bit further. And so I went and got my RN. I was in an accelerator program for my RN. So I actually got my BS in 16 months, worked at Northwestern Hospital, which is one of our top renowned hospitals here, on the neurology floor. So that kind of really introduced me into that realm of things. One, I suffer from migraines, so being able to work with that population was also rewarding for me. But as a tech, I was working as a tech first before I got my RN, and then I ended up getting my RN job at Mount Sinai. So in Mount Sinai, that's what really kind of molded who I am today in regards to leadership. I was 6 months out of nursing school, trained for charge nurse, trained for the PCC unit. I'm like, I am a new grad. Nobody's going to listen to me. And she's like, it's in you and blah, blah, blah. So I always also heard that charge nurse that pushed me past my limits. But as a registered nurse, we can only do so much for our patients when it comes to decision making. So I went back and I got a double master's. I did a double master's MBA and an MSN because me and my best friend wanted to kind of do a side business as like real estate, just something business wise. And so she already had her MBA. I trust her, but I still wanted to know something about business. Did that. And so I'm like, I still can't really make decisions for my patient. I need to go back to give me something that can allow me to be the decision maker. So that's when I went and got my FNP. And so I got my FNP. I was diagnosed, all of that good stuff. And because we have a huge gap in the mental health community with our Black and Brown patients, I wanted to fill that gap, which is why I went back and got my psych and mental health NP as well. The doctorate was personal. I didn't need it. It was something that I wanted because it is the terminal degree in nursing. To our patients, they don't know the difference between a medical doctor and a doctorate of NP. So when I see them in the home setting, it was always Dr. Keke, Dr. Keke. I'm like, oh, I'm not a doctor. I don't have a doctorate, so I got it so I can feel comfortable with my patients calling me doctor. I didn't need it. I was already starting a business. I was already in my career. It was just a personal accomplishment that I wanted for myself for the doctorate degree. So my nursing journey was basically in steps. So I've been in school since I think I did the calculations last year. I've been in school for 34 years.
Wow. Very similar. I'm sure there are people who are out there who are nurses or other careers, very similar, including myself. I mean, from school to school to school, like we become professional students. But, I would say, a couple of things you mentioned that I just want to highlight. You said someone saw some things in you. So it sounds like you might have had a little bit of mentorship along the way, may have had a little bit of pushing, like, encouraging you to go.
I consider myself an introvert with extrovert capabilities. So it's more so an ambivert when I need to be. So I'm just wanted to do my nursing and go home. And so she's like, oh, you should go and take the course to work in the step down unit. And you should go and train to be charge nurse. And I'm like, I'm just learning what hypotension is and hyperglycemia. And you want me to run the floor? It's like, you can do it and blah, blah, blah. And so, but I did it and I did it with ease. And anytime I worked, I technically was charged and everyone always loved when I was charged. And it just kind of really positioned me to be pretty much to prepare me for where I am today. It's kind of how I look at it. So I really owe it to her.
Absolutely.
That charge nurse back then that kind of like pushed me out my comfort zone.
So if you charge nurses are out there listening, Dr. Keke saying you could do more. I would just say that. So I want to ask you a question. As a dual board certified family and psych mental health NP, how do you integrate both aspects of care into your practice? One thing
that I like to say when I train my mentees, you got to know what your niche is, right? As a business owner. Especially in the aesthetic industry, so many people or so many spas are popping up on the corners now. Like a McDonald's is on every corner. It's almost a med spa on every corner. And so they get discouraged because they feel like the industry is saturated. Now, granted, it can be saturated if all you're going to do is pop up and do Botox and filler. So you have to identify what your niche is. So my niche is that we are a one-stop shop for all things health, wellness, and beauty. Why? I'm a family nurse practitioner, so I can take care of you on your primary care side. 2, I'm psych mental health, so I can also take care of you on your mental health side. And then 3, I'm now well-versed in beauty and aesthetics and wellness. So now you can get all your beauty needs there too. So you can get everything under one roof. So that's how I integrate it into my current practice. It's pretty much a one-stop shop for all things health, wellness, and beauty.
I love it. So how do you define, like, how would you just personally define like whole person care? Not like our textbook, right? Like our textbook, you healing for the mind, the body, and the spirit, but tell us why or how you define whole person care and why is it essential in today's
We don't know how to
healthcare
stop
landscape?
and be still. And so whole person care is setting boundaries for yourself, right? Being okay with the word no and allowing no to be a complete sentence. And actually, so for me, Mondays are my admin days. Wednesdays are my mental health personal days. Those days are like non-negotiable, especially my Wednesday, unless I choose to actually work and talk and Zoom and do anything on Wednesdays. It's pretty much a D&D, and that's my time, right? So whole person care is just actually being able to carve out time, and especially as entrepreneurs or busy professional women in our days, to actually love on ourselves. Like someone asked me a long time ago, not too long, a couple months, when was the last time that you actually loved on you, right? That can be just rubbing your feet, massaging your own neck, going to smell the flowers, whatever that may be for you. When was the last time you actually did it? So that can be scheduling a spa day, just coming to get a facial. What I like to do, my clients are all family. And when I say that, it's like when they come in, my students like, they act like you, they sister. I'm like that. Like they just come in open arms. I know their kids, I know their husbands, I know what they're going through. They very comfortable with, I mean, I end up being their therapist. Granted, I got the background for it, but it's just being able to allow that person to come into our doors. And for that moment, whether it's a 45-minute visit or 2 hours, they can escape from what's outside of those doors. So that's to me what whole person care is, just kind of being able to be one and be still with yourself.
And it's hard. It is hard in this society where everyone's just about the hustle and bustle to just stop. And some people use it as, centering. People use like meditation, all those kind of things to help
Yeah.
make themselves be still and sit, with themselves. So those are, excellent, good tips. Thanks for sharing that. You mentioned a lot about your entrepreneurial journey. Well, at least, a little bit, I will say, not a lot. I want you to share with us, like, how that began and the concept behind the development of Skyro's Rejuvenation Clinic and Spa. Like, what was your vision behind it? Number one,
Mm-hmm.
because God gives us a vision. And then sometimes we write it down, like the Bible says, write it down, make it
So
plain,
for
you
me,
know, and then, mhm.
mine was always like brainstorming. So when I actually started my business, I wasn't ready to start my business. And the story behind that is my best friend, she's an actress and a singer. And so she came up here to be opening act for this fashion show for another nurse who has a nurse clothing line. And so I went to support. And so it's called My Nurse Design. And so that was my first coach. She was actually my first business coach. So I went to the fashion show and I'm watching this powerhouse woman just kill it. Right now, I'm there to support my friend, but I'm like, who is this nurse with this business and she's running this fashion show? So I started following her. I love what she was doing. She ended up posting the informational about businessship, leadership, and entrepreneurship. So I'm like, well, let me go because I wanted a private practice later, right? I'm like, it wasn't something that was like, oh, I want to do this in the next year. I'm like, I know I want to open up a private practice. Let me work as an NP for a few years. And I want to do a private practice where I can offer Botox for migraines, Botox for excessive sweating, because I suffer from those things. So I wanted to be able to offer those treatment to my clients too, my patients. So I went to her informational. At the end of the informational, she launched her mentorship. And so I'm like, okay, well, let me sign up for that. We'll meet once a month, kind of just going over things. In my mind, I'm meeting with her and I'm like an information hoarder. So I'll get all the information, take notes, and then I'm gonna sit it to the side and go back when I need it. But in her mind, we're in real time. So we're doing actionable steps. I'm talking about starting my LLC, getting my EIN. And I'm still not really putting it together like I am starting my business. I'm still like, okay, yeah, I'm gonna put it up later. So that was July. We got incorporated. Actually, we will be 6 years old Thursday, my business. Yeah, so we got incorporated the 21st of 2019. And so fast forward to 2020, January, Sky Rose was launched. We met once a month. And even though I was in it, I still wasn't realizing like I am starting a whole business. Like I was picking my name. I was setting my bank accounts. I'm just doing everything that she's telling me to do, not realizing like we are starting my business. And so that's kind of how that came about. The name is on my daughter. So my daughter is Skylar Rose. So that's where you get Sky Rose from. So the prefix of everything in my business is Sky Rose, which is my daughter's name. So I knew it's going to be her name, but even just the name process, I think I had about 20 pages front and back with different variations of the name before we narrowed it down to the top 3. And then I end up choosing the one because I was like, you got to be careful with the name because you don't want people to see it and it's too long. They don't know what it means, whatever. So I didn't know if I wanted to be just medical group because I knew I was going to offer Botox. I didn't know if I wanted to say holistic because I didn't want people to think I was going to be doing woo-woo care and, how some people don't know what holistic means. So it's just like, what is the perfect name for it? And so we came up with the Sky Rose Rejuvenation Clinic because that tailors to my primary care side, and then the spa tailored to the wellness and the beauty side.
Now, do you have like other healthcare professionals that work in your spa as well, or are you the solitary? Okay. And are you the solitary NP?
So in Illinois, we have full,
that's a big role.
Illinois. So I'm pretty much my own medical director. And then I have the nurses under me. And then I have a virtual assistant and I have my personal executive assistant.
So what would you say like the best part, you said a lot of being a spa owner who actually has this background? Is it just because you can navigate all 3, or as far as the mental health with that background and as well as NP, what would you say is the best part?
Be that source, that vessel for all things. If you're looking for primary care, like on the aesthetic side, granted that is my primary focus, I catch a lot of primary care issues. And because of my background, I can either convert them to my patient or just make sure I refer them to their primary, but also give them that list of things to speak about with their primary because I know exactly what they should be looking for. We had a situation, actually my assistant, my EA, I'm her primary care provider because she ended up having a stroke 2 years ago. And she wanted a Black provider. And so she's like, could you be my provider? So I managed her. I had a client who came for under eye PRP 2 weeks ago. We drew the blood to get the plasma, but her plasma was thick and creamy. That's a sign of cholesterol issues, right? So it can be acute or it can be chronic. So what I told her to basically watch what she eats over the weekend and to fast when she comes back so we can see if it's a chronic situation or if it was just what she had to eat before she came to her appointment. So she did that. Plasma was clear as day. So what people don't know is what we eat, it affects our blood right away. So she had, I think, Culver's an hour before the appointment, and Culver's thickened up her plasma like that. She fasted that morning and her plasma was clear as day. Had it still been cloudy, then my referral would have been to have her PCP check her lipid panel. So we catch a lot of things, even just topically. They have that yellow discoloration under the eye, signs of cholesterol issues. So you need to, so we catch a lot of things on the primary side. So me being able to have that background in all of it, I feel like it's beneficial for my clients.
Absolutely. You said a lot about where the vision came from and how you began. So part of me is thinking like for our audience who may be interested in starting their own business, one of the first pieces I would think would be to write it down kind of thing, write it down, make it happen. But what is the first thing you would recommend a future nurse entrepreneur as they decide to explore this entrepreneurship?
I love this question because I get it all the time. So it's three things that I tell any aspiring entrepreneur that they need. One is mindset. They have to work on personal development, whether that's audiobooks, YouTube videos. I have an alarm that wakes me up with Eric Thomas' voice, that just kind of gets my day started. So definitely mindset, because this journey is not easy. It's not for the faint. It is going to be a lot of up and downs. And so you have to be prepared for those seasons where 1 month or 1 day you make $8,000, but then the next day you make 8, and maybe the next month you make nothing. Are you going to be built for that? Because it's all good when the money's coming, but when the money is not coming, what are you going to do? Are you going to give up? Are you going to stop? Are you going to continue to push through? So you have to have the mindset. 2, you got to get a coach. You have to get a coach, a mentor that is in that industry that you're hoping to get into, because they can help you avoid unnecessary spending of money, the mistakes that they may have went through. I tell people all the time, I teach my students from my mistakes. So I don't want you making the same mistakes that I made, spending the unnecessary money that I spent. I spent over $200,000 on my build out a couple years ago, and I downsized last year. I had to pivot. That was the hardest decision I ever had to make because I didn't get my profit from building out somebody else's building because I expanded too quickly to begin with. So that's a lesson for me. And so when I talk to some of these students, the first thing they say is like, yeah, I want to get a brick and mortar. No, you don't. No, you do not. You want to get a brick and mortar when your business is paying you what your 9 to 5 is paying you. You want to get a brick and mortar when your business that you're currently renting out is paying for itself, not because it looks cute for somebody to walk up to a storefront, because you still got to pay all those expenses. And then if you're building it out, you got to pay all those contractors. I had nobody to lead me in that. I paid over $200K in contractors, the plumber, the electrician. It was, they call it a vanilla shell. It was completely empty. So that entire place was my vision, and now somebody else is in there. When I had to decide to like not renew my lease and downsize, I was so in my head about it until I listened to Myron Golden. And he was like, a lot of millionaires and billionaires pivot in business multiple times. And that's enough. Like, it's nothing wrong with me.
I love him. I love Myron Golden. You know, you were kind of like leading right into my next question, which I was going to ask you, what was the biggest lesson you learned to date?
Yep.
And it sounds like that might have been the biggest lesson. You know, sometimes when you're new in business and new into entrepreneurship, you know, your biggest lesson is usually a financial one, right? So, you know, I would add to that question then, like outside of just getting a mentor, you know, or what you're teaching your people who you're mentoring about, sharing your biggest lessons that help them. Are there any other things that you would teach anyone based off of this big lesson that you learned?
Also locking arms with the right community, whether it be the aesthetic field, whether it be the real estate field, whatever field you're hoping to get into, surrounding yourself with the right people in that community is also going to be beneficial because you can learn from them too. So that's why even with some of the challenges I do, we create Facebook communities so people can be able to feel accountability partners with each other in the same state. But having that community and just seeing that you're not the only one out there doing the same thing. You're not the only one out there experiencing the same thing. You're not the only one out there going through the same thing. So to see that it's other people that is also maybe going down that same path as you or ran into that same obstacle, sometimes it helps to humble you too and just know like, okay, I'm on the right path. And you know, she experienced that, but look at her now. So community as well.
So I'm hearing a couple things. One, mentorship. Two, community. So they say there are many sayings about mentorship. Mentorship, if you have a mentor, number one, it'll help you to go places faster than you would just by yourself, right? Two, you know, the community that you built, you know, the Facebook community, people who are doing already what you're doing, that can affirm you, right, on your path, can help you to see this is the direction I am going. Other people have gone through this. And there's the saying that you should surround yourself with people who are going where you want to go,
Be the smartest,
you know, because that can help you get there. That's right. There you go. I want to pivot just a little bit because, you know, this podcast is called You Belong in Here, and it is a Black Healthcare Perspectives podcast. So would be remiss to not ask you, as a Black nurse practitioner and business owner, which the percentages are very low, right? I'm trying to get all of them on the podcast if I can, but you know, what challenges would you say you faced as a Black nurse practitioner and business owner, and how have you overcome them too?
One situation that comes to mind actually that I am building off of was when I first, and specifically not even just as a Black NP business owner, but a Black NP business owner in aesthetics. We are not welcome with open arms in this field. We are overlooked, we are undervalued, and we are underrepresented when it comes to Black and brown aesthetic practitioner owners. One thing that really fueled my fire is this psych doctor that I was going to work with in the beginning when I didn't have my full practice authority. She had a lot of hidden ulterior motives or whatever the case may be. So we kind of end up all parting ways with her, the ones that were working with her. But I think I was a threat to her. And I say that because she had the audacity to mention to another Black MP that I was not going to make it in this field because I was Black. And when she told me that, she said, what? She was like, oh, she said, the audacity.
The audacity.
I said, okay, I can show her better than I can tell her. And fast forward 6 years later, I am not only still in this field, a national trainer in this field that has trained over 4,000 other injectors. I have been speaking on their stages this last year, with another one coming up in 3 weeks in Texas, where I'll be speaking about diversity in aesthetics and how to tailor your treatment plans to women of color. But she said I wasn't going to make it. So I used it. I didn't let it break me, but it was just like, I love a challenge. I can show you better than I can tell you. So since you think I wasn't going to make it, I'm going to show you that I am. And I'm not only going to make it, but I'm going to do it great with excellent, Black's excellence at that.
Well, that's the makeup, I'm going to use the aesthetic term
Yes.
of resiliency. Like us as Black people,
Very
we
resilient.
are resilient people. I'm happy you mentioned too diversity and inclusion, because what role do you believe healthcare professionals play in advocating more like for diversity and inclusion within the industry?
We use our voice. We are key opinion leaders. Whenever I focus on something, I'm going to focus and I'm going to see it through to the point, like I'm going to be the best at it. So even though we're not welcome like that, one person that I met, she's like, oh, we need to infiltrate their table, and then I'll open the door and get other people. Why we got to infiltrate their table? Why not make our own? Why we got to go to their table? Like, why not make our own? And so I stood by that. And so now I'm being asked to speak. I'm being honored in October at one of the big conferences that's not technically tailored towards a lot of things. And as one of the 2025 distinguished women in aesthetics. And so they're covering everything. They're flying us down there to present us with this award because of the impact we're making in this field. So I just always say, when I put my mind to something, I'm going to see it through.
Congratulations. Let me say that first of all, and all the speaking engagements. I just came back from a National Black Nurses Association meeting. Are you a part of that organization?
I went to go on there. It's on my task of things to do, but I am looking into it. I was a part of the South Holland chapter, I believe, a couple years ago. My first business coach, she introduced me to them, but I need to reactivate.
Yes, please, because you need to come down there and speak. I think it will be so life-changing for many people who are looking and pivoting in different areas of the career. And it's a big thirst of knowledge there. And it's just amazing. So I definitely think you should, as well as I'm going to shout out to the DMPs of Color. I know I mentioned them to you too, who has a conference coming up in October. You have been amazing there too, girl, because it's awesome. I wanted to ask you, so at this point, where you are, what are your hopes for the future of healthcare, especially regarding mental health, wellness, and wholeness?
My goal is to continue to open up doors for more people that look like me, to position them to also be a part of the change that we need, filling in that gap for those particular industries that we need. But also continuing to just push ahead. I don't do it really for me. Like I said, I'm an introvert. I don't care to be on the forefront like you see me. Like if I had a choice, I would be a faceless Instagram, right? But I get so many messages, so many emails that you inspire me, you motivate me. You don't know how many people. So I do it for the people that are watching that I don't even know is watching. So my hope is that I just continue to be able to open up the doors and leave the footprints for those behind me.
Well, I love that. A couple things, just us as nursing professionals, period, doctoral level, NP, we all start somewhere, but we have, and even with being a business owner, I would think you realize there's a problem that you have to solve. I believe nurses are problem solvers, right? And we're also healers and we're hope deliverers. So when I'm an oncology nurse practitioner, but I recognize that when someone comes to me, a patient, when I see a patient, they want hope for me. They want me to give them that. And what you're saying is part of that delivery service. So we're getting ready to close pretty soon, but I'm going to track back. I want to ask you, what are one or two pearls of wisdom as we get ready to close that, if you haven't conveyed already, that you want to convey to aspiring Black healthcare professionals who are looking to pivot their careers into entrepreneurship?
Was scared. There's never going to be a perfect moment. I literally just got off a 6-week campaign for my academy, and the common denominator was fear. That was stopping people from wanting to do the transition, fear of the unknown. We don't know. We can plan and plan and plan, but God's plan is always going to be better. So you have to do it ugly. You have to do it scared. And once you do it and you get the feedback from that, now you can go and tweak it. But you got to start. And so one is do it ugly, do it scared, and bet on yourself.
I love that one the most, because why bet on other people? I look at it when you say bet on yourself, invest in yourself. I think some of the most successful people, while we're talking about success, right, is those who do invest
Yep.
in
And
their
look at it like that.
right?
Look at it as
The investment has to start with
in
you.
yourself, investment
Mhm.
in your growth, investment in the legacy that you're wanting to build. Is everything is not an expense. Everything is gonna not gonna be a revenue ROI where it's monetary, right? So you have to invest. Anything that I do that's gonna help to elevate me, whether it be mentally, physically, emotionally, or spiritually, is an investment. And so I don't look at it as an expense. If it has a dollar sign attached to it, okay, what am I going to get from it? And if I feel like I'm not going to benefit from it in any way, then I don't do it.
At the end of this, what does success look like, and redefining it? Investment.
Yep.
Investment in me, investment in you. So I love that. So Dr. Keke, before we close, how can listeners connect with you? Give us some information about how they can connect with you, and so they can write it down. And I also will have some in my episode notes.
Spa is located in the south suburbs of Illinois, Orland Park. Sky Rose Rejuvenation Clinic and Spa, as well as Sky Rose RCS Medical Aesthetics Academy. We are at 9505 West 142nd Street inside of Salon Loft. Virtually, my website is drshakikawilliams.com. That is drshakikawilliams.com. You can follow us on Instagram at Sky Rose RCS, which is the same for our Facebook. And we're also on LinkedIn. My name, Dr. Shakika Williams.
Well, thank you. Well, folks, this concludes this episode of You Belong in Here. Thank you so much, Dr. Keke, for being an awesome guest with so many pearls of wisdom for those who are looking to transition and pivot and, consider entrepreneurship, including me. We're going to chat after this, girl. And thank you, listeners, for tuning in. We hope, of course, that this episode reminds you that your presence is necessary in your workspace, that you truly belong there. And as usual, if you found this episode encouraging, motivating, and or empowering in any way, please like it, share it with others. You can find my episodes on podcast episodes on YouTube, Spotify, Apple Podcasts, and you can find more guest information there. So tune in 2 weeks where we continue to explore topics in equity in healthcare and equity in our workplace. Take care and keep pushing forward until then. Thank you, guys.